Welcome to the Mama Stay Fit YouTube channel. In this video, we're going to be discussing what breech position is, the different variations of breech, as well as what does that mean for your delivery if baby is still breech at term. I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I'm going to be discussing what does breech position mean, what are the different types of breech, as well as what does this really mean for your delivery. So between 2 and 5% of babies are still going to be butt down or breech position at term, and this just changes the options available to you at delivery. So first, what does breech even mean? So breech just means that the presenting part that's entering into the pelvis, so the part of the baby that is entering into the pelvis is the butt instead of the head. Sometimes babies can be sideways, so then it's their arm or their belly that's presenting, and that is what's called transverse. But in this video, we're just going to be discussing breech. There are different variations of the breech position. So there is frank breech, and this is where the feet are up by the head. So it is just the butt that is presenting to the pelvis. Then there's complete breech, where either the knees are flexed into the chest or like the legs are almost like crossed at the ankles down below. So it is the feet and the butt that is presenting into the pelvis. And then there's incomplete breech, where either one foot is maybe up by the head and then the other one is down below. So one foot in the butt is presenting for incomplete breech. Then there is the variation of footling breech, where it is just the feet that are presenting and entering into the pelvis. With footling breech, this is very abnormal and not common at all at term for a baby to be in true footling breech, because there's just not enough room for a baby that is term to be fully extended like this in the uterus. Most of the time, if they are considered footling breech or the feet present first during delivery, if they are a vaginal delivery, it is most of the time a complete breech, where the knees again were flexed into the chest, the feet are below with the butt, where the feet just presented through the cervix and the body first before the butt got there. Whereas with frank breech, the butt is the part that's going to present first because the feet are up by the head. The breech position is a completely normal variation of babies that are either head down, transverse, or breech. This doesn't mean anything is wrong with your baby necessarily. It's just a different variation of normal. The only difference is the options available to you at delivery if your baby is still head down. If you get your anatomy scan at 20 weeks and your baby is in the breech position, this is totally normal. The baby's vestibular system doesn't start to develop till about 24 to 28 weeks, which our vestibular system is within our inner ear, and this tells us what is up from down. So before that system is developed, babies do not know what is up from down, so they don't know like where their head actually needs to go until that time. So if at 28 weeks you get a repeat ultrasound to see what position baby is in and baby is still breech at that time, that is when we should start considering other options available to us, because this increases the likelihood that baby may still be breech at term. There are different options available to you if your baby is still in the breech position at term, and at 28 weeks is when you should start to consider these options. The first option is a scheduled C-section. Here in the United States, this is what is typically provided for people whose babies are in the breech position, is a scheduled C-section at 39 or 40 weeks, depending on your provider. The second option is you can ask for an external cephalic version, which means that your provider is trying to turn your baby from the outside, from breech or transverse to head down. This is a manual maneuver where they're using their hands to manipulate baby from the outside. There are different risks and benefits of doing an external cephalic version, or an ECV is commonly called, and then there's also different risks and benefits of a scheduled C-section. But there is a third option that is not commonly talked about, which is a breech vaginal delivery. This is an option that's not performed by all providers because it's not routinely taught in medical schools or residency programs anymore. There are courses that providers can take to learn this skill, as well as directories for you to be able to find a provider who is skilled in breech vaginal delivery if this is the option that you're wanting to explore. Breech vaginal delivery is a completely safe option if you have a skilled provider, and Birthing Instincts and Breech Without Borders are great resources to find either a provider through their directory or reach out for advice, and we'll link their websites down below. So just to recap, there are 4 different variations of breech positions. So frank breech, where the feet are up by the face, complete breech, where the knees are flexed and the feet are down below by the butt, Incomplete, where one is up by the face and the other one is flexed down below. And then footling breech, which is not commonly found at term, but can be found in preterm, where they are fully extended and just the feet are presenting. Breech position is a variation of normal that 2 to 5% of babies are at term in this position still. At 28 weeks is when that vestibular system is fully developed, where baby is going to be in that head down position, or usually if they're in the breech position, it's a higher likelihood of still being in the breech position at term. So this is a great time to start talking to your provider about those options for breech delivery. If you're wanting a scheduled C-section, does your provider do that? If they're going to perform an external cephalic version or ECV, do they perform those? Or if they don't perform them, and this is an option you're wanting to exploring, maybe finding a different provider at this time, especially if you're thinking about a breech vaginal delivery. If your provider does not perform it, this is the time to find a provider who potentially can support a breech vaginal delivery at 28 weeks rather than waiting until seeing if baby's going to flip at 36 weeks and trying to scramble and find a provider at that time, because it just limits the amount of time and your options available to you. If your baby is still breech and you're looking for movements to do to help encourage them to turn head down, check out our video below. And if your baby was breech at term, share your birth stories in the comments below. If you enjoyed this video, please sure to like and subscribe to our channel to be notified whenever we release new videos. We release 2 educational videos a week and 1 workout video. If you're looking for more support during your pregnancy of navigating your different birth options, check out our online childbirth education course, where we discuss all of the birth options and birth interventions available to you, as well as the science of labor and birth to make it less scary as you approach. Use code YouTube10 to get 10% off any of our online offerings, to include our fitness programs and our education courses. You can check out all of our courses at momstayfit.com.